It is an absolute pleasure to be here with you this morning, and I couldn't help but look at Rob and what a great presenter he is, and realizing that he's the good-looking date with money, and I'm the bad-looking date with no money for government. Rob asked me to really kind of lay the little bit of the land of what's going on in San Diego, and to me, with this audience, many of you can be up here giving this very presentation and know quite a bit of all the insights and challenges we're experiencing. But I'm going to take a stab at sharing with you, at least from my perspective, some 10 key issues and considerations from a local perspective, a regional perspective, of what's going on in terms of access to care and health in general. And did I get this right? Why we're here. You know, the state of unhealthiness has become a national threat. More than Al-Qaeda or terrorists, the state of unhealthiness is a national threat. The cost is unobtainable, and the current strategies and tactics we have today are not going to achieve this mission on this unhealthy war. And Rob really covered most of the challenges. Large numbers of uninsured, broken components of the delivery system. I'm obviously talking more generic across our country, because I think we've done some wonderful work here in San Diego, but even in our own community, we're seeing the clash between the cultural and social diversity challenges still trying to configure and fit in the more traditional medicine and practice of medicine, and the schism that presents. The chronic illness, and we'll talk quite a bit about this, being a driver for not only the majority of the medical encounters, be it for Medicare, but you're going to hear me talk about how it's become for things like children. So it's not the chronic diseases of the elderly exclusively. Now it's become a chronic condition of all ages. And this is the recent, most latest community needs assessment we have that the Community Health Improvement Partners puts together. And having been part of this great organization over the many years, we do this needs assessment. I can tell you what's alarming, having seen the last 5 needs assessment, is this emergence of things like diabetes, obesity. And so these metabolic disorders are creating chronic conditions. And if I had the other slide to show you, stratified against the age groups, you would see that 10 years ago, access to care was the #1 concern for young children and children. Well, today, it's diabetes. And sure enough, as you look at this slide, diabetes and heart disease, followed by mental health. Major challenges for us. So, it's a little bit ironic, isn't it? That we have some of the best technology in the world, by far some of the best subspecialists in the world. Yes, I hear it all the time. Well, we come to the U.S. for that specialty care. How is it then, though, we rank with developing nations in terms of our population-based outcomes, health outcomes, that we have huge numbers of uninsured, gross numbers of underserved areas in rural communities, inadequate number of primary care doctors, rising costs. We spend more than any other nation. So that schism, obviously, we all know exists in our country. So the question then becomes, are we really doing true health improvement, or is it sick care maintenance? I know this audience is to the former, and Rob alluded to the Affordable Care Act, and Donald Berwick is driving the triple aim. And it's doable, folks. It is absolutely doable. I have seen dozens and dozens examples nationwide of integrated health systems, to little physician group practices, to health departments, to partners coming together that have driven improvement, real improvement in quality of care, bringing down costs, measurable costs, total costs, and at the same time making broad-scale population improvement. That is really this triple aim, coupled with maybe a quadruple aim of having a positive patient experience in all this. And achieving this is not, to be underscored, is not going to be easy. It takes tremendous amount of what I call courageous creativity with new skill sets of collaborative leadership. The traditional approaches have failed. So new approaches are needed. Things like today, this innovation conference, bringing multi-sectors together and thought leaders together with people on the front line as well as social venture partners, thinking about how we solve these problems. And if you note on the new assumptions, I put in bold, national problems are going to be solved locally. They're going to be solved locally because they've attempted and it hasn't succeeded. We have the solutions in our own community. We know our communities best. Because if we punt to Sacramento or Capitol Hill, then I would say to you, if it's not us, then who? And if it's not now, then when? And so I'll talk more about the Affordable Care Act, but I will tell you certain things that are happening for sure. And this is more of certainty. And the first is there definitely is change, right? Change is in the air. And I'm not just talking about the Affordable Care Act. I'm talking about, in my world, the great disparity in funding and human need that we're experiencing today. What's the current economic reality? Here it is. My organization serves 500,000 San Diegans. 1 out of 6 San Diegans are served by the County Health and Human Service Agency. What are they coming in for? Health insurance, food assistance, job training. It's not just about chronic disease in terms of our reality in our community. People being released from prison, trying to reunify back into society. We have lots of challenges, and we're still, least we forget, thriving, and I should say surviving, an economic recession. Rob touched on it. We have severe budget deficits. And I would say they're not going to improve anytime soon. Not with the $26 billion deficit in Sacramento, who's talking about wholesale program devolution from state to counties. Massive more cuts in Medicaid and other programs. We have perhaps the largest federal deficit ever. And the ARA funding is coming to an end, which is going to impact many organizations that have been kind of counting on that funding the last few years. And least to say that counties and local jurisdictions are still sluggish in their tax receipts and keeping core programs. Historic levels of unemployment, foreclosures. I think you all know that the staggering statistic that the majority of personal bankruptcies is attributed to the inability to pay for health care, leading to disability, leading cause. We have classroom sizes. Yes, the nexus between learning and health, absolutely. Classroom sizes are increasing in alarming numbers. College students can't even finish their education because the classes are evaporating at community colleges. And we have shelters of all types, daycare shelters, mental health shelters, domestic violence shelters, disappearing because of the inadequacy of funding. And again, as I mentioned, the highest level of people on public assistance. The challenges are daunting, and that's why we're here. You know this, the rising costs. But what you might not know, what does it mean to San Diego? And here's the alarming part. We spend nearly $10 billion on healthcare costs, total healthcare costs in San Diego, annually. That's 5 times my budget annually. More than half of that is attributed to chronic disease and costs in treating chronic care. I don't know about you, but I can sure think of a lot more better ways of using that money. It gets to the point of the resources are within us. They're trapped in most inefficient ways. How do we unleash them? How do we really get the most out of $10 billion currently in the system? Soon to perhaps get smaller, not larger. So there's some game changers. Cost, clearly. But demographics, least we forget what's happening to the face of San Diego and the changing of its diversity. The thundering herd is here. That's the baby boomers. Don't you hear them? 60,000 a day are becoming baby boomers. Coming into the system, do we have an adequate system ready for them? Is the question. The chronic disease that we know that exists, the technology opportunities, huge game changers for the positive. Customer value, yes. People are demanding. Consumerism of healthcare. I really like Rob's point about let's make sure we treat folks as customers, citizens, not just a number, a client, but someone deserving of our respect. Globalization. With the busiest border crossing in the world, we should not forget about our partners down south. Because truth be told is, we do not have a San Diego health service delivery system. We have a San Diego, Tijuana health service delivery system. And we often just close our eyes to the border, but don't realize the ubiquitous nature of how many of our community are going back and forth. So how do we look at it from even an international health perspective? Yet another challenge for us. Health disparities is in its own class. You may have caught the article recently, UT. Half of all Latinos that live in the United States live in Texas and California. Latinization is happening in our great state. But it's not just Latinos. We have Iraqi refugees, Eastern African refugees coming into our community. Our community is changing. And yet, it's pretty sad when you think about a child born today. And I Googled it this morning, so I wanted to make sure. A 20-minute drive, less than 20-minute drive, less than 20 miles from this very place, we have a 10-year life expectancy difference of a child born around this community to a child born in La Jolla. That's San Diego. That is a field trip to take. That is unacceptable. 10 years of life. And so when you begin to look at then even the chronic disease, begin to look at diabetes, hypertension, and how that adversely impacts African American males more than any other groups. We see great disparities across our system. How do we begin to address these disparities? So I challenge you in this innovation is not to go to where it's easy, but to go to where there's already great need in closing that gap of disparity.